Hey everyone, welcome back to another episode of Physiology 2, especially for you. In this video, it will be about the pathophysiology and the connection to exercise to put everything, especially for a young physio, into context. All right. In earlier videos, we looked at different pathologies. So in this one, we will provide you a little bit more context as to where a physio could actually have an influence on the physiology on these patients with these conditions. So for example, for COPD or asthma or any of these cardiac conditions, we will have a look at the possibilities. Although we will not go into depth too much in this video, that will be covered in future pathology videos and pathology lectures, and definitely in future physiology lectures and courses we will dive a lot deeper. So this is more to provide context to understand how exercise physiology in the future should be applied and directed. So we looked at pulmonary problems before, so hopefully by now you understand the difference between restrictive and obstructive diseases. And then especially for COPD and asthma, we looked at a few more details. So also here in the connection to exercise, hopefully it's clear what is affected, what you can still do, and maybe what you should accept. For the cardiovascular problems, you see in literature that a lot of research is done on patients with coronary heart disease, hypertension, other cardiac conditions in relation to exercise. So, what is possible? What can exercise still give to these people? So, it's an important target group for you as a future physio. To provide some context in terms of numbers, here you can see a graph that shows a clear decline in the number of deaths in heart disease patients. So you can see compared to, let's say, 70 years ago, the amount of deaths due to a heart or cardiac issue definitely dropped a lot. And great deal can be attributed to the actual intervention and the prevention, where also physios play a role. In this graph, you see that still numbers are quite large in terms of the impact that cardiovascular diseases have in different countries compared to how many people die from these diseases. So it's definitely a very relevant and a very large patient category. And here you can see that compared to these categories, based on data from 2014, you can see that definitely it's in this graph the biggest factor, cardiovascular diseases, in relation to the number of deaths. So there's definitely an impact that you as a young physio can have by trying to help these patients with their lifestyle and other physiological improvements. For coronary heart disease patients, basically the coronary arteries are affected. So if you think about exercise possibilities, that's what your background should be. But if patients have a severe coronary artery issue, then as you know, either angina can develop or ultimately an infarction. So then irreversible damage is done to certain cells, which will affect stroke volume, but the severity of the damage will determine the severity on the effect on stroke volume. So for you as a physio, again, it would be important to also know the severity of an underlying condition so you know what's still possible and what the possible training effects still are. For hypertension, the main issue is that the body is constantly stressed and strained to a higher level than for another person with a relatively normal blood pressure. So, what it could cause in the end is heart failure, is more risk on of infarction. So, it is a factor that should be managed, should be monitored, and that again is something that physio can have an active role in. Heart failure is sometimes the consequence of many years of high blood pressure or the consequence of an infarction or for other reasons. And it basically shows that ejection fraction is significantly affected. And then sometimes this could be accompanied by pulmonary edema. And that is the reason why sometimes patients come in with coughing or supposedly pulmonary issues, but then the underlying condition could be an actual cardiac problem. And then we have a few other categories, as we mentioned also earlier, with either peripheral issues or valve related issues that you could encounter in your future career as a physio. So, especially the capacity that they still have left and the capacity that potentially is there to improve to, that is an important factor to always keep in mind before you start working with these patients. So, what can you do as a physio? Well, first of all, you have to be able to determine the risk factors that are involved. Although some of the factors that we know from research as a risk factor are something that you cannot really influence. So, it's important to realize, but there's no real intervention possible to do something about the uncontrollable risk factors because, by definition, they are uncontrollable. So what you should look at are the factors that you could influence as a physio together with your patient. So what could that be? That could be, of course, any lifestyle related factor. So smoking, developing high blood pressure, inactivity, nutrition, all these factors can play a role in trying to manage at least the risk factors and reduce the number of risk factors in order to reduce the actual overall risk. So, finally, the question is, of course, in relation to physiology, what should we do? Well, in this video, you can see a beautiful explanation of what you should do or what you should advise your patients to do for 23 and a half hours per day in order to have the biggest impact on the overall risk of developing all sorts of cardiovascular and other issues. I'm not going to play this video right now. It's roughly a 9-minute video. Please sit back and relax when you watch this video separately. But it's a beautiful animation on the history and the impact of physical inactivity and physical activity. And the title, 23 and a half hours per day, shows what you should do at least for the remaining 30 minutes. So have a look and the rest will be clear. So, not a surprise from all the literature that's out there, we can see that physical activity has a lot of benefits. So, exercise is super important for many reasons. So, that's why in this course, we will give you an introduction into exercise physiology so that you understand what happens during exercise, what happens over time due to training effects. And then finally, in the future physiology courses, you can follow up with a lot more detailed exercise physiology for healthy people and finally also for patients. So in the next slides, I'm just going to walk you through some of the questions that you might want to answer at this stage and definitely later on in your career. First of all, although the answer was given already to some extent, why do I need exercise? For what purpose? What does exercise do to our body? What are the training effects that I can expect? What are the instant effects due to exercise and what are the training effects? How do I train? How do I test? All these questions are relevant. So some of these we will walk through right now. And then later we will follow up in this course with a final video on exercise physiology. And then in future physiology courses, you will get more details as mentioned before. Well, why exercise? Just once more, if you look at cardiac rehab and the research behind it, you can clearly see that if you put cardiac patients in a solid aerobic training program, you can see a lot of aerobic improvements. You can see that endurance training increases the left ventricular function, stroke volume will be increased. You see that plasma volume is increased. You can see that the ratio of capillaries to muscle fibers is improved, which means that there's a better perfusion of blood, and a lot more physiological improvements are visible after, let's say, 12 weeks of solid aerobic training. So it's clearly the reason why exercise. Also, side effects are related to blood pressure, but also mental effects, stress levels, and other physiological markers are significantly improved due to aerobic exercise that is executed in a systematic way in 12, 20, or 30 weeks. So a good cardiac rehab program definitely focus a lot on the physiology, but also on lifestyle, psychological, and other aspects. So it's a multi-professional, multidisciplinary approach if you want to have the biggest impact, because it's not just about physiology, although in this course we will focus clearly on just the physiological aspects. But what you see is that in rehab, you see that patients are evaluated several times by the cardiologist, but also by the physiotherapist. And definitely a maximal exercise test is very often a requirement for a good start, for a good baseline measurement, in order to follow up and set a training program that, at least from a physiological point of view, is sound and potentially as effective as possible. So exercise prescription starts with good exercise testing, also in cardiac patients, in pulmonary patients, in order to have a good and solid program. So finally, I would like to encourage you to have a look at the guidelines. For example, the cardiac rehabilitation guideline of the KNGF, in order to see which variables are mentioned in the guideline, what are the exercise intensities that they recommend, what kind of tests are recommended, and also for the bigger picture, what other lifestyle interventions other than physiology, are advised in the guidelines. So definitely for you to put everything into context, please have a good look and try to see if you can recognize the variables that we mentioned in these videos and see if you can already start applying them with your patients. So that was it for this video. I thank you very much for watching. I really hope to see you in the next one. And for now, some confetti to celebrate that you've completed another video.